Welcome to Stem Cell Genius, powered by R3 Stem Cell. I'm your host, Samantha Breckner, president at R3, and each episode, I sit down with our founder and CEO, Dr. David Greene, to answer your most pressing questions about regenerative medicine. From stem cells, exosomes, and PRP to the latest breakthroughs in treatment and science, we're cutting through the noise and giving you real answers from one of the world's leading experts. This is Stem Cell Genius, your front row seat to the future of regenerative medicine.
And welcome back to the Stem Cell Genius podcast, the only show where even a skeleton like me is trying to get some life back in my joints.
And I'm the brains of the operation, literally. I'm here to keep things smart while she tries not to fall apart.
Hey, give me a break. I'm just feeling a little empty today, all right?
Well, that's why we're here, talking about stem cells, regenerative medicine, and how people are getting their bodies back instead of just rattling around like you.
Whatever. Why don't you sit back and use your brain?
My brain is flowing out of my... That's why it's just a brain here, because I've gotten so smart from writing the book that I don't even have a body anymore. It's all brain.
Hey, I love that. You must be a little bone tired, huh? All right, we ready to really do this podcast?
Let's do it!
Your prop.
Yes. It's my blankie.
Your emotional support brain.
That's right.
All right, Dr. Greene, why don't you tell us what we're going to talk about today?
So today...
Absolutely not. Don't cover your mic.
Oh, shoot. Yeah. All right, you be good, okay, brain?
All right, Dr. Greene, tell us what we're talking about today. I know revolving around costs, right?
That's right, yeah. So a lot of people that call in, they want to know, at some point, maybe right off the bat or at the end of the consultation, what is this going to cost me?
Right.
Right? Now, I prefer to call it an investment because that's really what stem cell is an investment in you or a family member. But at the end of the day, a lot of people, they look at one clinic versus another, and it comes down to cost A versus cost B. Mm-hmm. But it's a little more complicated than that.
Yeah, I mean, especially because, people don't know what's going on the backside of things and how their stem cells are actually being made, their exosomes are being made, whatever it might be. So they're just looking at a piece of paper saying, oh, I'm getting 150 billion and it's costing this much here and this much with you. And why is it more expensive here, less expensive here, so on and so forth. So
it's understandable because if you have two quotations sitting in front of you and you're pretty new to learning about stem cells and having consultations and understanding that they can help you. Right. There's a good track record for that. It's not so easy to understand what are the differences from a nuanced standpoint of all you people call and say, well, this one's cheaper.
Right.
This one's cheap.
Why?
Why? So that's that's why the topic is what it is today.
Totally. And it kind of revolves around, to set the standard, what you were telling me about earlier today, where, we don't want to be the Walmart. We don't want to be the Nordstrom. We want to be like the Target, right? The place where everything is in its place and it's nice, but it's not, super cheap. It's not super expensive.
If you look at brands that rank well in a consumer's, brain for quality, to my mind, it comes down to Walmart or Lowe's. Lowe's advertises on prices. Mm-hmm. So not to pick on those two brands. I'm just trying to point out some big box that people, know about.
Stereotypes. Yeah.
Yeah. But at a certain point of being the cost leader in the industry, something's going to give.
Right. Absolutely.
And that's not so great when that something is going into your body, and it could be a quality issue.
Yeah. So what do you think are some of the differences in quality that set us apart from, let's say let's start on the cheaper side of some of our competitors, with R3? What makes them cheaper but the same amount of cells, right?
Well, we see this globally. We have clinics, as you know, in 8 countries. As you know, you're our president, of course you know. And we're the world's leader, right? 28,000 and counting stem cell procedures. We've seen it all. And it's not just in Mexico, it's also in Turkey, the Philippines, any country that we're in. A lot of people, they don't have the track record that we do. They don't have the value add, like with the PRP and the exosome add-ons and things. So what do they market on? Price.
Right.
And to a small extent, they might get away with that. But at a certain point, they realize, I can't bring a quality product that's also safe to the market and still have something left over.
Right.
So when you look at our competitors in the market, a lot of them do that. They've recently opened up their clinic, or that's an add-on to what they're already doing. Like, I can make some extra money doing regenerative medicine. They don't really know the science. They don't really understand themselves. If you don't understand the differences as a provider, how are you going to convey that or make that proper decision for a patient?
Right.
So let's talk about the 3 different aspects of the triangle.
Right. Okay.
Let's talk about safety first. Okay. Then we'll talk about quality, and then the third part of the triangle is, cheap versus affordable.
Yeah. Price. Safety, quality, and price.
Yeah. Our vocabulary doesn't have the word cheap in it, right? Affordable, attainable, things like that, because we're not going to be the cheapest out there, and here's why. So from a safety standpoint, you have the regulatory standards of the United States FDA, and then you have...
And that's worldwide.
Right,
exactly.
Yeah.
So no matter what clinic you're going to, you're getting top quality.
If you look at and it's not very fun to read, it's actually a very good cure for insomnia.
That's exactly why... exactly why you read it for us.
If you want to read it,
we trust you, so you do all the hard part, and then just let us know the answers.
if you want to go read it, I'll bring back Skelly as.
Skelly, yes, you like Skelly. Host. You named her apparently.
She can't get a word in edgewise. She can't get a word in ribwise.
Hilarious. Hilarious. She told me she was feeling a bit cold today, too. I'm glad you put a shirt on her.
Her teeth are chattering a little bit.
Not everybody's not going to like this podcast.
Yeah, I know.
They're either going to love it or they're going to hate it.
Let's get back on track. Okay,
safety, right?
Safety, yeah. So the U.S. FDA is very, very, very strict when it comes to the, they call it quality control safety standards for disease testing. There's a long list. And then safety testing. So it's interesting because when we look at labs internationally and also here in the States, it's expensive to do that testing.
Right.
If you do it at scale, like we do, then it brings it into the realm of affordability that we bring it to the market for.
Right.
But if you don't own the lab, or if you're buying in small quantities, you're going to have to pay a premium.
Right.
Which means that I don't know if I can charge that much to a patient.
Right, right. And let's talk about why safety is so expensive, right? First of all, there's so many tests that we run.
Yes.
But not only are there so many tests that we run, but we're testing so many vials too. Yes. So not every vial that we produce, gets given to a patient. 20%, isn't it 20%
now, yeah,
is being sent out of every batch for testing, and it gets cultured for 14 days, tested for endotoxin.
Yeah.
It goes through everything. No call from the third-party testing is a good sign, right?
It's a little bit mind-blowing. You realize how much of the product is being used to make sure that the rest of the product is going to be okay.
Right.
And when you look at the actual testing, it's critical for a few reasons. One is if you take, and I'll give you some examples, you take a bunch of vials and you process them and then you put them into the cryo freezer, and obviously they go very, very cold and are frozen, that can kill bacteria in and of itself.
Absolutely.
Right? So if you don't test enough vials or even if you test all these vials to 20%, they may all turn out to be negative. We also test for endotoxin, which a lot of labs in a lot of countries, they don't do it.
Absolutely.
Endotoxin is remnants of bacteria that can indicate to you that there is an infection present that you're not, seeing. So endotoxin is very, very important, and it's not cheap though. So a lot of labs just say, we're going to skip that one.
Yeah, absolutely, because it's not required.
Yes.
But it's expected, right? It should be required at this point. Something else I want to bring up, which is absolutely amazing with the products we use from our lab too, is not only are we testing cryopreserved product, but in the middle of testing, we're testing the liquid product as well, about halfway through, just to ensure that we can move forward with our process too. So, because I wanted to bring that up because I know you mentioned that when it gets cryopreserved, some of the bacteria dies, right? But what about all the bacteria that stayed in this vial but not in that vial from the cryopreservation and so forth? Well, actually, we also test the liquid too before we cryopreserve it in the middle of our process as well. So we have lots of process steps to ensure safety and confirmations, hey, we're on the right track.
God, you're not just an empty skeleton. You're full of knowledge.
No, am I the genius?
I don't know. You want the pillow? I can go find it. Yeah, I had forgotten about that. We test at the end of processing. We test during processing. We also have the settle and touch plates
Absolutely.
in the room to make sure there's no contaminants, that aren't even in the liquid, that are in the room.
In the air in general.
Yes, exactly.
Absolutely.
So it's important, but it's not required necessarily outside of the United States. So a lot of people just don't do it.
Right.
We do it, we require it for our biologics anywhere.
Exactly.
In the world.
And I think that our safety and our quality is a lot of the reason why we have the reputation that we do.
Yes.
And that's why, we're not the cheapest, but we're not the most expensive, 100%, because people know because of not only how we're known, but we have great track record of results, an 85% patient satisfaction rate. If you see absolutely no results in 12 months, guess what? We're still here for you. Let's talk about it. Let's see what we can do. Throw in some exosomes to see if we can give you a booster. What's going on with your post-care? Are you eating well? Are you exercising? What are you doing on the sidelines that we're not seeing that we can help you with, right?
Well, so the additional question is, how do you take, when you do that level of quality control for safety, how do you take that's very expensive to do it and make it affordable?
Right.
And the answer is it's an economy of scale.
Right.
You do a lot of it.
Right.
Right? And
More
then,
bulk, lower the price.
That's right. Your prices come down and we pass that along, to the patients. And I think that was the initial goal 14 years ago, and that we've achieved that with that economy of scale.
Right.
I love it. A few years ago, a patient said to me, God, I love you guys. You're like the working man stem cell clinic. And I was like, yes,
We made it.
Well, it says a lot to me, because when you look at our pricing compared to like Panama or Colombia or some of those, we're less than half. And we try not to raise our prices maybe once every 4 years or something. And we're in the middle of that cycle right now, but it's very comforting to know that is resonating, and that's what's happening.
Absolutely.
Yeah.
Totally agree. So we talked about safety and quality and kind of cost.
A little bit.
We kind of went around the
we
triangle.
did, actually,
I
yeah.
know. Is there another point we need to hit?
Well, we hit the quality part, the safety part and the affordability part a little bit. Let's talk about the other part of the triangle, which is quality of the biologics themselves. So in addition to what we see with other labs skipping some of the safety testing that might be a little pricier and trying to find a lab that is willing to cut some of those corners, we also see a lot of labs that do things such as diluting their product. Like, oh, we have a nice concentrated product after the processing. Let's put some saline in it so that we can get more of it but that means that it's at the detriment of what the patient's going to receive.
Right, right. What about also overculturing?
Yes, that's another thing. So I've talked about this a lot, but we're not allowed to use cultured cells here,
right.
but we can use them everywhere else. And we do because it makes it more cost effective. Now, every time you take a flask of stem cells and they go to the edges, they become confluent, then you can take those cells and put them into additional flasks and culture more. That's called a passage.
Right.
Sometimes we refer to it in layman's terms as a generation.
Right.
But it's well known in research circles and from the International Society of Stem Cell Research, you shouldn't go past the 5th passage. So we don't. We often stop at the 3rd or the 4th. So it means that what patients are getting is very, very high quality, but very cost effective at the same time.
Right.
So when you hear people talking about, oh, you culture and therefore it's not as good, that's not true.
Right.
They're just as potent and pure.
They're still just as young, and we're watching them, right? I mean, eventually, though, you also have to think about, yes, 5th is the standard, but it's not a law, it's not a rule. How many of other companies are going to the 18th generation?
No, I'll give you a classic example. So last month...
it's a graveyard.
I know it is, yeah. So I got a call from... it's not a graveyard, but they're not functional, right? So that's another problem that we'll jump into right after this. I got a call from a lab in Europe, small country, Lithuania, and they were so proud of their GMP lab.
Oh, no.
And so I'm listening, and I'm thinking, well, I don't really have a need to go into Lithuania. There's only a few million people there. I'd rather help, countries that can support it. But they said, here's our certificate of analysis, which gives all the data. And they were going to the 10th passage. And I said, did I read this right? This says 10. And I asked him to explain his explanation of what a passage was. And yeah, they were going to the 10th, and they thought that was totally copacetic.
Yeah. Strange. I mean, and I know sometimes you don't like this, but I think about cloning. And eventually, if you clone something so many times, it's going to start looking a little different, Has anybody seen a movie? What I mean?
So I call it the Xerox copier phenomenon, which ages me a little bit. Do you know do you remember Xerox? Please say,
I've heard of it.
Please say yes. Please say yes. Yes. Okay. Thank you.
Okay. You're welcome.
I'll get in rooms. I'll give a presentation.
I only said that because you're 28 next month.
So a lot of these providers that come in for trainings, they're young, right? So I'll say that, and they'll be like, "Excuse me, what's a Xerox?" I'm like, "Oh gosh, you've got to be kidding!" I mean, I feel like I'm
ancient.
Yes. Yeah.
That's why your brain's so big.
That's right.
It's true. There we go. Nice little spin on it.
Oh, and I may look young, but I'm 95 years old.
Yeah, it's wild.
So anyway, the Xerox copier phenomenon. You get a Xerox copier or a Canon, all right, or some Hewlett Packard. Let's use the newer, and you make a copy and it looks tremendous. You're like, oh my God, I can't tell the difference.
Then you copy that copy.
Eventually, it starts to look a little fuzzy.
Yeah.
And that's what happens after the 5th, 6th passage is the stem cells don't look spindly like you want. They look like an amorphous blob.
Right.
So you look underneath the microscope and you're like, yeah, that's not really going to help these individuals. And then you start to run the other tests, which are not cheap, by the way. Trilineage differentiation.
Right.
All the surface markers that exist, and then the lack of surface markers, and then there's a few other tests as well, karyotypes and oncogenesis and things that you want to test for. But there's a price tag to those, and a lot of labs are like, we don't need to do that.
Right.
We can overculture, we can skip a bunch of tests, and then offer the stem cells.
Here you go, $2,000.
Yes.
Bye. Have a nice day.
I mean, we do price matching, as you know.
Right.
And
if
it's comparable. So a lot of folks from certain clinics, I'll keep their names out of my mouth for the moment, but I know when I get a quotation from them, I know where they're getting their cells from. I know how that lab does their SOPs, and it's suboptimal. I said, look, I know you thought you were getting a deal for a quality treatment. But $2,500 for 100 million stem cells is not reality.
Right.
It's not comparable.
Yeah.
So
I
that's a
was
shame.
giggling when I really like your photocopy metaphor. I think it was a lot better than mine. If you clone somebody, they're going to start working a little bit.
I'm really big on analogies.
I think I like yours better than mine. I'm going to use yours. It's much better. It's much better. Mine was a little messed up, I feel.
So, we see this frequently. And it's also, when it comes down to quality, I would say stem cell counts. So if you're going to get 100 million stem cells
that A, have gone to like the 15th passage, B, they don't handle the stem cells carefully.
Right.
Stem cells don't like to be manhandled. They like to be handled gently. But, a lot of labs are in a hurry. They got things to do, and they're just, sloshing things around. And there's a lot of shear stresses that kill these cells.
Yeah.
And then you have to be careful with the cryopreservative. You want to use enough to where it's going to preserve the cells, but not too much to where it's going to have the counter effect of killing them. So in Mexico, we test competitors all the time. And I can tell you that more often than not, it's like a graveyard under the microscope. Sad. So you're getting 100 million stem cells, but how many are you getting that are viable and functional?
Right.
10 million? 20 million?
Right, and if you're going to spend $8,000, you might as well get something that's actually going to do something.
Right, exactly.
You know what I mean?
Yeah.
I mean, at least a little bit of something, or something that we feel confident in. We're not just scamming you and saying, hey, come hang out with us for a couple hours for $2,500 and then you'll be on your way. We're not going to follow up with you. We're not going to make sure you're seeing results.
Yes. I mean, think about the fact that in most of the world now we're offering live cells. Now, when I say live cells, I mean non-cryopreserves.
I probably should use the word fresh,
Right.
because we offer live.
Although they're cultured, they're still fresh.
That's right. Yeah, and even the cryopreserved ones, we have a very high viability.
Right. I mean, don't we only cryopreserve with what, 5%?
5%.
Yeah.
Yeah, cryopreservative. And, our viability rate, we tested every batch, is on average about 92%.
Right.
Very high. Now, with fresh stem cells, that's
99.
I mean, nobody else really does that. We were the first to offer that. How? It's because we go to like the third passage, let's say. Between passages, we test for sterility. And with that final passage, you don't have 2 weeks to test for sterility because you're offering them fresh.
Right.
So for that one, we do some rapid analysis and then microscopic testing. And then when we wash them and preserve them right out of the incubator, boom, 99, 100% viability.
Right. You can see them right there. They're warm to the touch.
It's amazing.
Yeah.
I mean, the results are incredible. I'd put our results up against any stem cell clinics in the world, even ones that are triple the cost of ours.
Yeah.
You can't get any better quality than that.
Right.
Yeah, so in the last part of the triangle, we have the affordability, which we've touched on. But, there's clinics that offer to, cheap, and we talked about that. But when you talk about affordable, it's not just that our pricing is very affordable.
Right.
And we price match comparable quotes. We also offer a lot of value above and beyond. For
Right.
instance, we don't charge for the multivitamin, the Myers cocktail.
Right. Everyone gets a Myers cocktail.
Why? Because it's very beneficial to help prime the system, to help the stem cells activate faster.
Right.
And on that topic, when we do injections, we add PRP, some of your own blood, and spin it.
At no cost.
At no cost. Other clinics charge $500-$700 for that. We just include it. Why? Because it helps, once again, to accelerate the activation of those stem cells and provides a scaffold for new tissue regeneration.
Yeah.
The other thing we offer is free ground transportation around the world. Not really here in the States, but everywhere else.
For more of a medical tourism type of...
Exactly. Yeah. Hotel, if it's 100 million stem cells or more, we'll provide a couple nights in a nice hotel. and then we'll pick you up from the hotel and vice versa.
We're with you every step of the way.
Yeah, that's right. Yeah. And then the other one is at a certain amount of stem cells will include a base amount of exosomes.
Yeah. On the house.
On the house. And the reason is not just because it's something to throw in.
Right.
It's because we know it's going to improve. Mm-hmm. It's going to help you get the results faster. That's one thing that exosomes do. And also they work together with the cells to perpetuate the magnitude of those outcomes.
Yeah, that's the regenerative trifecta right there.
Yeah, the actual trifecta, which I have actually, let me get that pillow.
Okay.
Check it out.
Ooh.
So you see, R3 regenerative trifecta. Mm-hmm. Right, so the regenerative trifecta, we came up with that, right? And it's proprietary to R3, it's trademarked, and nobody else offers it. So if you're getting a spine or joint or other type of injection, the regenerative trifecta is when we combine PRP, exosomes, and mesenchymal stem cells. And results are through the roof.
Yeah.
It's amazing.
I know, and I think a lot of other people are doing it now because they know we're doing it and we're seeing results.
Yes.
Right?
Yeah. Now, the combination that we put together is a proprietary cocktail, but others are trying to imitate what we do. But, you know, it's not so easy. Yeah, you have the highest quality of cells with the passage that's below. Just right. The exosomes that are very highly concentrated.
Right. And the addition is just right.
Yep. And then, of course, you know, PRP. So I just feel like, you know, nobody is getting these types of insane outcomes, especially for back pain, neck pain. Yeah.
Absolutely. All right. Well, Dr. Greene, anything else you'd like to add today?
No, we covered it nicely. I do want to mention that the book is done.
That's right. How many pages?
Oh, God, it's 475 pages. My brain is coming out of like my ears now.
That's why it's so big.
Yeah. It's crazy. But it'll be available for download soon. The publishers are putting the final touches on the actual manuscript for the download, and we'll have the information on r3stemcell.com and stemcellgenius.org.
Perfect. And I heard you're already working on the next one.
I am.
Yes.
I am.
Did I spoil it?
No, I mean, it's interesting. The field keeps on moving, you know.
Right.
So by the time I finish this one, there's a lot of new stuff to write about.
Yeah.
So, yeah, it's happening.
Exciting stuff. Awesome. All right. Well, you can visit us online at r3stemcell.com, or you can call us at +1-844-GET-STEM to see if you or a loved one is a candidate. Stem Cell Genius out.
SCG out. Boo boo, boo 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 boo. I'm doing it sideways. Boo 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 boo.
Stem cell therapy is considered experimental and is regulated by the U.S. Food and Drug Administration, but is not FDA approved. R3 Stem Cell does not offer stem cell therapy as a cure for any medical condition. No statements made on this podcast have been evaluated or approved by the FDA. This podcast does not provide medical advice. All content is for informational purposes only and is not a substitute for professional medical consultations, diagnosis, or treatment. Reliance on any information provided by R3 Stem Cell, its employees, others appearing on this podcast at the invitation of R3 Stem Cell, or other visitors on this podcast is solely at your own risk. R3 Stem Cell does not recommend or endorse any specific tests, products, procedures, opinions, or other information that may be mentioned on this podcast. R3 Stem Cell is not responsible for the outcome of your procedure. The FDA considers stem cell therapy experimental at this point.